I want to talk to you about what you're looking forward to most in the next year in terms of innovation and new tools, new techniques that are coming to the forefront that you think are going to impact patient outcomes in Australia.
One of the things that I've been really interested in Australia at the moment, we're getting a lot of thrombectomy devices becoming available. So essentially what these devices are, if you get a clot in your artery, these instead of ballooning it or instead of doing an open cut and trying to remove the clot, these are catheter systems that you can put next to the clot. You turn on a button and it sucks the clot out, or it macerates the clot and removes it. And I think this is going to be a big game changer for limb salvage, because I know for a fact that a lot of my colleagues, when a stent blocks, in their mind, that's it. Oh, the stent's blocked. I either have to do a bypass or chop off the leg. But these devices allow you to go into that stent and remove all of the material that's in that stent or in that artery, and it looks like brand new once it's all come out. And actually, I should preface this by saying we've been doing these procedures here for a while, but it's only now this year, 2024, that the companies are really competing with each other to get their devices into more hands in the Australian market. And I think one of the reasons is Abbott are really pushing their JEDI system, and now suddenly the other pre-existing guys are saying, oh, geez, we better invest more as well. So I'm hoping that that is going to really allow a higher rate of salvage of occluded stents and occluded arteries where previously people were giving up. So that's what I'm excited about in Australia for the next 12 months.
And are you dealing with just DVTs, but are you getting those devices such as with Inari, and there are a couple other ones that have them for the pulmonary embolisms as well?
Yeah, so you can obviously remove clot from the venous circulation. So we've got Inari to mention, we've got JEDI as well. And, I had a patient, I think it was about 4 weeks, not that long ago, who had a very, very bad DVT. And the traditional treatment is you make a cut in the groin and you pull out all of this clot, and then they sit there on the ward for 2 to 3 weeks with the wound breaking down. And anyway, I used the JEDI catheter system for the vein clot, and she was home the next day. It was fantastic. It's such a big change for DVTs. However, the main thing I'm really excited about is on the arterial side, because it's way more common that we get blocked arteries over here. And yeah, I think these devices, so you've got AngioJet, you've got the JEDI system, the Rotarex system, and they're really impacting the way that we practice. I've seen, I've been doing Rotarex at least for a couple of years now. I've seen patients where every single artery in their leg is gone, is blocked. And you do Rotarex, you pull out the femoropopliteal clot, you do an outflow angioplasty, and then everything looks beautiful. And they're back out, they're back to the community, back to their life. And sure, they come back in, 9 months, 12 months, everything's blocked again. You do the procedure again, and back they go. And these procedures, you do it, you can send them home the next day. I mean, it really gives patients, it's not perfect because they have to come back, but still, it means that they've got their independence. They don't have to go to a nursing home, et cetera, et cetera, et cetera. There are just so many benefits, I feel, to these devices. Yeah.
I mean, it's especially beneficial to the patients, but then to the entire healthcare system, and above and beyond that, as Dr. Marco Manzi from Italy, one of the pioneers in endovascular, always says, socially, the impact socially of helping people to maintain their independence is priceless. Why wouldn't you do everything in your power to help improve not only the patient's life and the impact on the patient's life, but that on society? right? And remove
Agree.
those unnecessary burdens.
Agree 100%. Absolutely correct. Yes.